I'm Ricardo Bartel. I'm happy to be here. I'm sorry that invited me to be there presentially, but sadly I have a 2-year-old girl and 1 month. So I've been recently a new father. So it's kind of hard for me to move right now from home, and also time management is not something I can arrange easily. So that's why I know that being in recording is less than ideal, but at least I can manage time. The less time I have, the what I can do for in this kind of situations for this. Okay, so thank you for the invitation. I hope that will consider me for being potentially in another edition of the course. I would be able probably, and I would gladly be there. I would love to be there, actually. So my first presentation today, it will be about how to get started with endoscopic ear surgery. This is mostly like a philosophical presentation, mostly of how was my journey is starting with endoscopic ear surgery, and how was my journey to get there, and how I got the manual abilities that you need to get there for surgery. First, I will not bore you with the equipment and what you need to use, how to grab an endoscope. I think everyone everywhere being an ENT surgeon has some experience with sinus surgery, so endoscopes are not a new thing to handling and to manage. But important of some of the equipment that we evolved to, it's from, for example, the endoscopes. At first, when we started our journey with endoscopic ear surgery, we started in 2016 we started, and we started using the normal sinoscopes, 4mm 14 centimeter long endoscope for sinus surgery, and after a couple of years, 3 years, we evolved to the 3mm endoscopes. So it's completely feasible. You can do it perfectly. Endoscopic, we started with it, we learned with it, and actually in some cases, for example, in cholesteatoma surgery, I still prefer to use the 4mm because you have a wide angle view. It's the view. I think it's better for the as a bigger endoscope. The view is better. So, and usually, and for tools, for regular tools, we use regular otology surgical tools. So we didn't have to buy any equipment just for starting our practice. So that's about the equipment. It's important to know that if you want to start, you don't need anything new, just your hands and having the idea of starting with your practice. So you don't need anything new. So, importance that we all know that what the endoscopes will give you instead of the microscopes, that you will have an enhanced visualization. For me, improved visualization is very important because you need to see what you're doing. You can see actually what you're doing, and every time you can arrange and arrive to places that with the microscope you couldn't do it. I don't have any much experience working with a microscope inside the tympanic cavity. On the mastoid, yes, we use it all the time, every day. But inside the mastoid, the tympanic cavity, as I learned with the endoscope, every time I use the microscope, or I want to use the microscope to see inside the tympanic cavity, for me it's like wasting my time because I'm not seeing the quality. It's very inferior. So it's not, for me, it's not an option anymore to use the microscope within the tympanic cavity, because it's so much different and it's so much better with the endoscope. So another point when you are going to start the endoscopes is another point, very, very important point that I was going to say it here in equipment, is that in your practice, what will give you the advantage to learn how to use the endoscope in the year is not once a week where you go on surgery, is using the endoscope as much as you can most of the time. So that will be your office, your clinical practice, your outpatient clinic will be your place where you're going to learn to grab the endoscope, when you're going to learn to take earwax without hurting the patient. It will give you a lot of spatial abilities, and that's where you're going to learn to use the endoscope. Not actually, it will be much slower if you only use it in your surgeries. So it will be better and faster for you to learn if you use it on your daily basis. If you use it 20 times a day on every patient, you will learn fast. If you just use it for surgeries, you will learn slowly. That's for sure. And then the learning curve. It's important to highlight this because the learning curve probably is different for the endoscope than from the microscope. When I talk with my colleagues that first learn with the microscope, working on the tympanic cavity, and then they pass to the endoscope, it's different. The learning curve, the logic paces you need to learn, the order, as if you learn directly from the endoscope. Because, for example, mostly the major change will be, we will agree probably that inlay laryngoplasty would be the first procedure to learn, or grommets. Then underlay laryngoplasty, you learn to elevate the tympanomeatal flap, deglobe the malleus, but still it's not hard to do if it's not active and it's not bleeding. And here's the major change, because probably stapes surgery is for microscopic surgeons is one of the hardest surgeries to learn, but with endoscopic surgery it's not a hard surgery. It's actually quite easy because it's not bleeding. You can see anatomy perfectly. You can work within the prosthesis a little bit in an angle, so you can see exactly where you put it. Working on the foot plate is very different if you work with the endoscope or with a microscope. Because with the foot plate, with the endoscope, it's not every other thing in the way between you and the foot plate. You can move just to one side and see everything in an angle, and you will see every single step of the way from the endoscope, from your other hand through the foot plate. So it's not a hard surgery to learn. That's a major change. And then type 2 or 4 tympanoplasties with active problems with cholesteatoma or an active phase, and then cholesteatoma surgery will be one of the hardest for me. And then the last one, because it's a hard surgery, anatomy is changed, there's a lot of bleeding involved, there's a lot of changes, inflammatory changes that change the anatomy quite a lot. Active suppurative chronic otitis media, they always have some type of tympanosclerotic plates or things that makes you difficult. So for me, what I've learned is that probably the logic steps for learning endoscopic surgeons in the endoscopic ear surgery will be passing from this to the other procedure, in this order. So some important pearl and some tips. The most important tip for me that changed majorly my practice, my surgery, and my surgical time is when you overcome the tympanomeatal flap. If you want to overcome it without the bobby, it's a long learning process. If you want to overcome it with the bobby, it's very easy. So I taught my residents and the otologists that I taught in my team after me. I taught them to go directly with the bobby because it's so much easier. And here's how I want to tell you how I do it. Mostly I just infiltrate on the superior aspect where the stria vascularis is. just 1 point for infiltration. And then I just use the Bobby in a potency of 5 watts, no, not more. It's not necessary to go on 10 watts, but if you go on 5, it will be enough to avoid bleeding and avoid retraction of the flap. And as you can see here, bleeding is minimum, and the elevation of the flap it's quite fast and easy and without complications. This will also give you the advantage of the less bleeding will give you the advantage of being faster, not just raising the flap, but also in the other parts of the surgery, because you won't have this leakage of blood within your surgical field all the time. So this is actually one of my most important tip I can give you when starting your practice. Now you can elevate it however you want. Probably won't, if you're experienced surgeon, won't bleed a lot, but in this case it's just for starting. I think it's very important. So I didn't invent this. I just saw it on a paper, and then I thought it would be very interesting. So we tried it, and actually it worked very, very good. And for bullet points of this of going this way, I will tell you to use the endoscopes on your office practice every day on your daily basis. It will be amazing how much the ability or how manual abilities you will get on the process. And then I will use important to apply the correct learning of order procedures. So you don't start with a cholecystoma surgery, you start with myrincoplasties. And actually the most important that I like the most is use the Bowie for elevating tympanometer flaps. It will save you a lot of not energy, just mental energy, because overcoming the flap is very, very mentally exhausting, and a lot of time. And also it's important to say again that you don't need new equipment to start your practice. So every one of you can start your practice right away. So that will be this talk. And again, thank you for the invitation. I will gladly be there, but have family issues that cannot be left unattended. So I have to be here at home, and I will love to be there on another occasion if Amin wants me there. So thank you very much, and see you on the next presentation. Thank you.